I thank the Deputy Speaker for asking me to speak. The Health and Care Bill allows for a profession currently regulated to be removed from statutory regulation when the profession no longer requires regulation for the purpose of the protection of the public. Now, Labour voted against this clause in committee, but we were defeated by the government. So I have tabled Amendment 57, which would remove this clause from the bill and ensure that a profession currently regulated cannot be removed from statutory regulation and that statutory regulatory bodies cannot be abolished. I'm very grateful that this amendment has received cross-party support. The removal of a profession from regulation is deeply concerning because once a profession is deregulated, we can expect the level of expertise in that field to decline over time, and along with that, the status and pay of those carrying out those important roles. It also brings with it serious long-term implications for the health and safety of patients. The government said in the white paper which preceded this bill that this is not about deregulation. We expect the vast majority of professionals, such as doctors, nurses, dentists and paramedics, will always be subject to statutory regulation. And they go on to say, but this recognises that over time and with changing technology, the risk profile of a given profession may change, and while regulation may be necessary now to protect the public, this may not be the case in the future. It's notable that the government only says it expects the vast majority of professionals will be subject to statutory regulation, but it's not giving a guarantee. The fact is that if this bill passes, ministers could change their mind at any point and make changes through secondary regulation. It would appear that the government is arguing that technological advances may change roles to such a degree that the high level of professional expertise that currently serve the NHS will no longer be needed. I'd like to make 2 points about this. Firstly, if the work of an NHS profession has changed to such a degree that regulation is no longer needed, I would argue that this is then a different profession and would need a new job title. Secondly, when deploying new technology, there is always a need for professional staff with a high level of expertise and understanding of not only the functionality of that new technology, but also its shortcomings. Technology has the power to improve productivity, but it should not be used as an excuse to deregulate professions. It's important to consider where the impetus for this may be coming from, and certainly the recent lobbying scandals given us a clue when we consider the number of MPs on the government benches with private interest in medical technology. I don't want to elaborate on that today, but I did want to make the point. Certainly we know that big business is keen on deregulation because it allows them to pay lower salaries to staff. A representative of Virgin Care said during a seminar on wellbeing, development, retention and delivering the NHS People Plan and Workforce Fit for the Future earlier this year, she said, and I quote, "We should have flexible working for all. We should consider what this means. We should embrace what that means. Both of those things really push what has been quite a traditional work model across the NHS. We need to be more modern. We need to have a think about how we rip up the old rule book, but change in an area that is very risk averse because the nature of the work that we do is really tricky. So we need our leaders and our workforce to embrace trying things." I think it was a very alarming statement that she made, and I think that we would all agree that healthcare professionals' understanding of risk and the importance of mitigating risk is incredibly important. And it's always, I believe, a matter of concern when business says it wants to rip up the rule book when it comes to employment rights and pay. In summing up yesterday, the Minister said that the bill does not privatise the NHS, but I have to say I disagree with him. ICBs will be able to delegate functions, including commissioning functions, down to provider collaboratives, and provider collaboratives can be made up of private companies. So I don't understand what it is that the Minister doesn't understand about that. And add to that the fact that the abolition of the national tariff will open up the opportunity for big business to undercut the NHS. This is a potent situation indeed, and one which will be exploited by big business if it goes through. The late Kailash Chand, former Honorary Vice President of the British Medical Association, said, and I quote, "The core thrust of the new reforms is to deprofessionalise and downskill the practice of medicine in this country so as to make staff more interchangeable, easier to fire and services more biddable and above all cheaper." The removal of professions from regulation is a part of this scenario that he describes. And now turn to workforce planning. Madam Deputy Speaker, there is a workforce crisis in the NHS. In fact, that would probably be an understatement. Earlier this year, I met with members of the Royal College of Nursing in the North West who told me of the sheer exhaustion that they are experiencing they are experiencing because of staff shortages. And I was struck by how, even at this point where they were describing how they are on their knees with exhaustion, their primary concern was patient safety. And we owe it to them to address this matter. The British Medical Association has highlighted that burnout has led to a significant number of medical professionals considering leaving the profession or reducing their working commitments. According to the latest figures, there were well over 90,000 full-time equivalent vacancies in England's NHS providers. The best the government can come up with in this bill is to require the Secretary of State to publish a report at least once every 5 years, describing the system in place for assessing and meeting workforce needs of the health service in England. That, I believe, is woefully inadequate. The Royal College of Physicians says that this duty on the Secretary of State, quote, falls short of what is needed given the scale of the challenge facing the health and care system. And the Royal College of Paediatrics and Child Health is among those who have called for this duty to be strengthened in the bill. So I would ask the government to listen to their expertise. The government's plans to remove NHS professions from regulation is wholly unacceptable, and it's particularly alarming at a time when there are such acute shortages of staff right across NHS professions. We all value the NHS highly and respect the high level of professionalism in the service. Instead of looking to deregulate professions, the government should be investing in the training of the next generation of professionals.
Hear, hear, hear.